What is the main risk of using excessive heparin during cardiopulmonary bypass? A. Hypotension. B. Hemolysis. C. Heparin-induced thrombocytopenia, HIT. D. Excessive bleeding. Answer: D. Excessive bleeding. Explanation: the primary risk of using excessive heparin during CPB is an increased risk of bleeding. Heparin is an anticoagulant, and while it prevents clot formation during bypass, excessive doses can impair the body's ability to form clots and lead to excessive bleeding. This is why heparin is carefully monitored and its effects are reversed at the end of the procedure using protamine sulfate. Which of the following is the most important consideration when using cardiopulmonary bypass in a patient with aortic insufficiency? A. Maintaining a high perfusion flow rate. B. Using a pulsatile pump to mimic natural circulation. C. Monitoring intraoperative blood glucose levels. D. Using higher doses of heparin to prevent clotting. Answer: B. Using a pulsatile pump to mimic natural circulation. Explanation: in patients with aortic insufficiency, the use of a pulsatile pump is particularly important during CPB. Pulsatile flow mimics the natural pulsatile pattern of blood flow, which helps maintain coronary perfusion and minimize regurgitation through the aortic valve. This approach is beneficial because it helps maintain adequate myocardial oxygen supply and reduces the risk of complications such as myocardial ischemia. Which of the following is true regarding the use of retrograde cardioplegia during cardiopulmonary bypass? A. It is used to increase myocardial oxygen demand. B. It delivers oxygenated blood directly into the left atrium. C. It helps induce myocardial arrest to allow for surgery on the heart. D. It is used to improve venous return to the heart during bypass. Answer: C. It helps induce myocardial arrest to allow for surgery on the heart. Explanation: retrograde cardioplegia is used during CPB to induce myocardial arrest. This involves delivering a solution, typically a cold, potassium-rich solution, into the coronary sinus, which then flows backward through the coronary veins to arrest the heart. This allows the surgeon to operate on a still and non-beating heart. It does not increase myocardial oxygen demand but rather protects the heart during surgery. Which of the following would most likely be monitored to assess the adequacy of hepatic perfusion during cardiopulmonary bypass? A. Arterial blood pressure. B. Liver enzymes, e.g., AST, ALT. C. End-tidal carbon dioxide. D. Urine output. Answer: B. Liver enzymes, e.g., AST, ALT. Explanation: liver function during CPB can be monitored by checking liver enzymes such as AST, aspartate transaminase, and ALT, alanine transaminase. Elevated liver enzymes can indicate hepatic injury or inadequate perfusion. While urine output is often a useful indicator of renal perfusion, monitoring liver enzymes is more directly related to hepatic perfusion. What is the purpose of using a centrifugal pump in cardiopulmonary bypass? A. To increase arterial blood pressure during surgery. B. To maintain constant blood flow and pressure to vital organs. C. To oxygenate the blood during the procedure. D. To filter waste products from the blood during surgery. Answer: B. To maintain constant blood flow and pressure to vital organs. Explanation: the centrifugal pump in CPB is responsible for maintaining constant blood flow to the patient's vital organs during surgery. It provides the mechanical circulation needed to bypass the heart and lungs, ensuring that blood continues to circulate and perfuse organs. The pump is designed to maintain a stable flow rate and pressure, preventing ischemia in critical organs like the brain and kidneys. Which of the following is the most common method for cooling the patient during cardiopulmonary bypass? A. External cooling pads. B. Ice-cold intravenous fluids. C. Cooling blankets. D. Using the oxygenator's heat exchanger. Answer: D. Using the oxygenator's heat exchanger. Explanation: during CPB, cooling is typically achieved using the heat exchanger in the oxygenator, which regulates the temperature of the blood circulating through the bypass circuit. This method allows precise control over the patient's temperature and is effective in inducing hypothermia for organ protection. External cooling methods, like cooling blankets or ice, are not typically used for cooling during CPB. Which of the following is the most significant advantage of using a membrane oxygenator during cardiopulmonary bypass? A. It requires less anticoagulation compared to bubble oxygenators. B. It allows for higher gas exchange efficiency while reducing the risk of air embolism. C. It is more cost-effective than other oxygenators. D. It increases the viscosity of the blood, improving perfusion. Answer: B. It allows for higher gas exchange efficiency while reducing the risk of air embolism. Explanation: a membrane oxygenator uses a semi-permeable membrane to separate blood from the gas flow, providing efficient gas exchange, oxygenation and carbon dioxide removal, while minimizing the risk of air embolism. In contrast to bubble oxygenators, which introduce gas bubbles into the blood, membrane oxygenators allow for more controlled and effective oxygenation with a lower risk of air entering the bloodstream. Which of the following is typically used to monitor the adequacy of systemic perfusion during cardiopulmonary bypass? A. Central venous pressure, CVP. B. End-tidal carbon dioxide, ATCO2. C. Arterial blood gas, ABG, analysis. D. Transesophageal echocardiography, TEE. Answer: A. Central venous pressure, CVP. Explanation: central venous pressure, CVP, is commonly monitored during CPB to assess the adequacy of systemic perfusion. It reflects the pressure in the vena cava and right atrium and can provide insight into cardiac preload and venous return, helping guide fluid management and ensuring optimal perfusion during bypass. While ETCO2 and ABG analysis are also useful for assessing oxygenation and ventilation, CVP specifically evaluates perfusion status. Which of the following factors is most important for minimizing the risk of neurological injury during cardiopulmonary bypass? A. Maintaining a high flow rate during bypass. B. Ensuring adequate perfusion pressure and oxygenation of the brain. C. Maintaining a low body temperature throughout the procedure. D. Using a non-pulsatile flow pump to avoid brain overperfusion. Answer: B. Ensuring adequate perfusion pressure and oxygenation of the brain. Explanation: the most important factor in minimizing the risk of neurological injury during CPB is ensuring adequate cerebral perfusion, which includes maintaining appropriate blood pressure and oxygenation. Inadequate perfusion or hypoxia can lead to neurological damage. While hypothermia can protect the brain, it is not a substitute for maintaining adequate perfusion pressure and oxygenation during surgery. Which of the following is the best way to prevent air embolism during cardiopulmonary bypass? A. Using an arterial filter. B. Maintaining a high flow rate throughout the procedure. C. Regularly checking for blood clots in the circuit. D. Placing the patient in a Trendelenburg position. Answer: A. Using an arterial filter. Explanation: an arterial filter is an essential component of the CPB circuit that helps prevent air embolism by capturing air bubbles and preventing them from being pumped into the patient's arterial system. Air embolism can cause serious complications, including stroke or organ ischemia, so careful management and the use of filters are critical for patient safety.